What we looked at here, specifically looking at patients that got the full 6 cycles that we think is the most effective way of administering radium versus those that got 4 or less cycles. So 5 and 6 cycles, 4 or less, to look at their outcomes. So we had already known from Alsimca that it looked like patients who got the full 6 cycles or even 5 did significantly better in terms of survival than those that got 4 or less. And we found the same phenomena with the extended access program, where there was a statistically significant improvement in overall survival in those patients that got 5 and 6 cycles compared to those that got 1 to 4. And then we looked at what parameters predicted getting 5 or 6 cycles. And as expected, patients that were healthier earlier in the disease continuum were more likely to get the full 6 cycles of Radium-223. And the 4 parameters that were most important were PSA levels. So under 140 were more likely to get it. That was statistically significantly better than those that were above 140. Looking at pain, so patients with no pain or mild pain were significantly more likely to get the 5-6 cycles that we need. Hemoglobin also was predictive. So if patients had hemoglobins above 10, they were much more likely to get the whole 6 cycles. And so those are parameters that help us to figure out how to target patients more likely to get the 5-6 cycles. And on the flip side, maybe not wait too long, because then we're unlikely to give what we think is the most effective form and dose of Radium-223.